Can you tell us a bit about your role and what are you doing here at the World Health Summit regional meeting?
Well, I think I'm here for a number of reasons. First of all, because I'm part of the World Health Summit team in Berlin. And so we run the global summit every year in Berlin, and then there is the regional summits, and I'm the co-chair of the World Health Summit Council. And so I have been part of also supporting and planning this summit. So that's one side. I think the other side is my contributions to global health, to health promotion and public health as a professional. And the third is probably because I do have a variety of links to Australia. I've spent time here in Melbourne. I've worked with Vic Health. So there's a number of reasons why I'm here.
And obviously we know that the regional meeting has a focus on the Pacific region, Asia Pacific region. What is the significance of having such a regional meeting that have a focus on this particular region?
Well, first of all, I think this region is frequently neglected when we discuss global health. There is a tendency to look towards Africa and maybe some other Asian countries. But, the Pacific often gets not enough attention, also because of its sort of geographical location and the smallness of some of the nations and societies, the complexity of it all. And so I think in this case, it was really, really important to us, if I say us, the Berlin team, when there was the application by Melbourne to run this conference, that we said, yes, we really want Melbourne to do this, but it must be, and the Monash agreed 100%, it must be a Asia-Pacific meeting on the one hand, and on the other hand, of course, it must also draw attention to specific groups like, the role and of indigenous populations.
Okay, so you were on the advisory board for the development of German global health strategy, and you have advised in the establishment of the WHO hub on pandemic and epidemic intelligence. Can you tell us a bit more about what is the pandemic and intelligence? What is that about?
Well, we learned through the COVID pandemic that we need new kinds of data, intelligence, knowledge around, what actually leads to pandemics, how do we deal with pandemics. In previous times, one might have spoken about interdisciplinarity or intersectorality, and of course One Health is an expression of that. But we know that in order to better understand the origins of pandemics, we need to organize knowledge differently, and that is captured in a sense by the word intelligence. And so we wanted to send the message, this is not just about traditional epidemiology, let's collect a few more data, but also of combining them differently, of projecting them differently, of looking into the future. So to also explore through the abilities we now have through the digital transformation, through simulation. So many of these new kinds of approaches that where one might not always know the exact outcome of it. One of our models was the CERN model in Geneva. You research without necessarily knowing what your exact outcome is, but your outcome might change the world. And so it was the idea that while, there's a lot of tools that one needs to share, that there is also a need for innovation in the whole field of data. And that's what we wanted to express.
So obviously that's a very solutions-driven approach in terms of approaching the epidemic challenge in today's society. So my last question is, we have three themes on this regional meeting. It's health issues with geopolitical tension and thriving community, but also climate change. What is the biggest challenge, you think, in the Asia-Pacific region with relation to these three themes for this regional meeting?
Well, I think many people in the Asia-Pacific region would say it's climate change because it affects them so drastically also in their everyday life. And of course, many of the island states, but also Australia and others have been strong voices in the multilateral arena to draw attention to this. On the other hand, we do know that the geopolitics are really making things very, very difficult right now. And we also see in some of the island states in this region how they are trying to balance this geopolitical tension with working on the one hand with China, on the other hand with Australia, of not being pushed, to be on one geopolitical side or the other. And so I think, then finding agreements on addressing climate change or addressing inequalities, at least at the global and regional level, will to some extent mean that one needs to find ways of working together despite the very strong geopolitical tensions. And I think the geopolitical tensions in this region are getting stronger and tougher. We can see that. And I think, again, particularly for small island states, that's going to be a very, very difficult situation.
Just for curiosity, how does the geopolitical tension actually affect the health of a nation?
Well, it's geopolitics affects who you partner with. Who is willing to give you financial and political support. It affects multilateral negotiations at the regional level and at the global level. It can lead to pressures on your government, and it will always, influence the amount of decision-making power that actually a country has. And therefore, geopolitics, if you think of the pandemic agreement, which is being, heavily influenced by geopolitical tensions, but many of the other things, the sharing of knowledge, the sharing of data, the sharing of vaccines, who gets access, all of that is also defined by geopolitics. And that's why it's a tough time for some countries right now.